Assalamu alaikum dear doctors. In this video I am discussing the history taking of bone pain. So bone pain, the cases are thalassemia, rickets, JIA, sickle cell anemia. The present history, first we start by OCD, that is onset, when it started, course and durations. Then after what increase and what decrease the conditions. Next site, where exactly the pain occur and change or not, timing, when happened the bone pain, association and radiation, the pain is radiated or not, the character and scale. Pain scale, we know that 1 to 10, and we need to check the severity. We tell this scale. Awakening from sleep, the pain is that awake the child from the sleep, and fever associated with fever, sun exposure, similar attack. We know that during sun time the rash appear on the cheek, that is SLE. Now looks like you and her daddy, her intellectual ability to check the dysmorphism, any syndromic child or not. Next is FWASL. We know that F for fever, associated with fever or not, W for weight gain or weight loss, A for activity or any appearance, S for sleep, and L for lymph nodes or gland. Any other concern, we can ask the mother, is that any other concern associated other than bone pain, and any chronic condition associated with this bone pain. Systemic review. So in systemic review in bone pain, first we musculoskeletal system we check, MSK, that is that the pain associated with bone swelling, any redness over the bone, hotness, joint swelling, hair and nail changes, neck swelling, and any other lumps in the body. Next is nutrition. In details we take the nutritions, that breastfeed or formula fed the baby is taking, amount per meal, who prepare it and how many times. After nutrition you go for the GIT. GIT, that is the bone pain and also present with tummy pain, tummy size, is that the tummy size is increased or not. We know that hepatomegaly, splenomegaly, any lump, then tummy size can be increased. What about her poo? Is it difficult to flush? Any soreness, anal tag, is there is yellowish discoloration? To check the jaundice we can ask this question. Next we check the CNS, central nervous system, any abnormal movement, abnormal gait, vision, hearing, is that the vision and hearing is normal. Signs of increased intracranial tensions like vomiting, nausea, these are the features. Headache. Chest, for chest any recurrent bugs infection, cough, flu. Hematological, we can check by is there the bone pain has any pallor, bruises, recurrent infections. And endocrine, we asking prefer certain whether is that the bone pain with polyuria, polydipsia, and weight loss. So past history, we know 5T IOA. What is 5T? That is any trauma history, traveling history, treatment history, multidisciplinary team. Which team is treatment doing? And the next one is blood transfusion. That is the 5T. And IOA, we know that I is investigation, O for onset, and A admissions. Next, VANT, allergy, vaccination, that the baby take all the shoot regularly. And development history, nutrition history, that is VANT. Next, family history, home modifications, social history, psychological, especially in chronic fatigue syndrome. Psychological, is there any bullying present or not in school? So differential diagnosis of bone pain, what are the case in bone pain? That is psychological can be present, chronic fatigue syndrome, growing pain which is awake him from sleep, then hypermobility, tumor like weight loss or metastasis is present in tumor. Then trauma or any non-accidental injury also causes bone pain. Infection or inflammation like arthritis or osteomyelitis. Endocrine causes parathyroid affection. Hematological, that is thalassemia, sickle cell disease, and hemophilia, which are involved bone. And bone dysplasia, either rickets or secondary to nutritional renal malabsorption. Hepatic causes X-linked hypophosphatemic rickets and vitamin D dependent rickets. So this is the easy way to take the history of bone pain. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.